Mark Mendonca from MCAC. Welcome to MCAC's monthly Empower Me series. Thank you for joining. Today we have a distinguished speaker, Varsha Singh, MSN APNC. I will read out her short bio and then she'll start. Varsha considers herself as a healthcare professional who thinks out of the box and is always ready for a challenging role. Her key focus is on patient engagement and patient experience improvement. She usually function with patient-centered approach and believes that in order to excel as a healthcare organization, patients are central to everything. Varsha currently works as a director, ambulatory nursing, stroke slash diabetic education. Her education include doctoral student, state Seton Hall, University College of Nursing, Masters in Nursing Science, Adult Health Nurse Practitioner, Prescriptive Privilege in State of New Jersey, Bachelorate Degree in Alternative Medicine, BHMS, Bombay, India, and Registered Nurse with license in New Jersey State. She has several accolades and has been an avid speaker at several venues on various health topics. Most recently, she conducted several sessions for MCAC members on preventing stroke through a fast FAST technique. Many of you attended that session. Her awards include FNAP, NJAP, and Excellence, Nancy Fontana Scholarship Award, March of the Dimes, Nurse of the Year Award, Advanced Practice, New Jersey State Award for Union County College. Varsha is well connected with the community and providing her services. Her affiliation and membership include President-elect New Jersey Stroke Coordinators Consortium, President-elect FNAP NJSNA, immediate past President NJSNA Region 3, President-elect NJ Stroke Coordinators Consortium, past President AIN NJ2 American Association for Indian Nurses 2012 and 2014, Advisory Board SATI South Asian Total Health Initiatives 2011 to current, VP of Communications Region 3, New Jersey State Stroke Consortium 2012, PR Chair NINA, National Association of Indian Nurses of America 2010 to 2012. Simply put, Varsha believes that the excellence should be the nature, not the choice. Today she's going to talk about a very important topic titled Integrating Medicine. Ladies and gentlemen, please welcome Varsha Singh on this very interesting topic. Varsha, over to you.
Good evening, everyone. I welcome you all to this webinar. And before I start this webinar, I want to very much thank Mark Mendonca and Merlin Mendonca. Since I have met this dynamic couple, I have seen such a dynamism in both of them, and they have been talking to me for past couple of months that I should be presenting a webinar on a subject of my interest. So why integrative medicine? I'm talking about integrative medicine in a country where modern medicine is all about getting a prescription from physician, getting a disease diagnosis, and then making sure that someone takes that medication for life as prescribed. So integrative medicine is a topic which is not new to many of you, but it is a new concept in this medical world, where someone needs to know what exactly this integrative medicine means. My effort here is to make you think out of the box. That's how I think, because there are so many possibilities. There are so many ways we can heal our body. Just the medications are not enough. And my nature, my inclination towards integrative medicine is only because I have practiced homeopathy in India for about 8 years, from 1991 to 1998. 98, I came here in this country. And integrative medicine has been part of my life since I am probably born, because my grandfather practiced yoga. My family practiced yoga. We used Ayurvedic medication all the time. Half the medication came from our kitchen. So, what is it that we need to know about integrative medicine and how we can incorporate? It is integrated medication. So, we are not giving up one modality and we are not changing, but we are integrating two different modalities to heal our own body. Not just healing, if say there is no disease, there is no diagnosis, and we are well, so we are going to use this integrative medicine to keep ourselves healthy. So let me start this webinar with a hope that after my presentation, you all are going to go and do your own homework. You're going to look up on internet and see what fits for your life. So Mark, can we have our first slide, please?
Sure.
And I'm just, in the meantime, I'm just going to say a disclaimer um, that this presentation is by no means to make you stop what you are doing right now for your health or stop taking your medication. I really want you to understand the concept, and then you go and you actually have a conversation with your primary provider and find out what can I do? What is something more that can help me? So let's look at what are my talking points, which is in the next slide. So this slide, I just want to give you a bird's eye view, and I will be talking about what is integrative medicine, which also incorporates what is mindful living. Then I'm also going to talk about why are we looking at this concept of patient as the partner. You are not just a customer now. All the patients who are taking treatment for the illness, now you are equal partner with the provider. I'm also going to describe a few complementary and alternative medicine which are being offered and which is gaining more and more popularity, because in future you will look around and you will see more and more medical spas coming up in each and every state of United States, and also back home in India or anywhere in the world. I'm also going to focus a little bit on what is mind and body wellness, and how health promotion and health prevention practice is going to help anyone with the disease management, even with those chronic diseases which are quotes said incurables. And lastly, I'm also going to give a perspective about how someone has to keep an open mind and be open to explore around and not just have the approach that nothing can be done anymore. Okay, next slide, please. So this is a model which actually I have given the link thanks to this organization that has put up this diagram. And if you look at this, this is our mindfulness. It is just a diagrammatic representation of how we should be looking at every perspective of our own life which affects our health. When I started learning homeopathy, I went to school for about 5.5 years. It's a medical school where they teach you everything about how they teach you in the normal, regular, or I would say traditional medical school, anatomy, physiology, biochemistry. But the pharmacopoeia focuses on homeopathy. And the homeopathic philosophy says that all the physical afflictions, that means all those symptoms that we feel in our body, are the outcome of our affected mind. So when you look at this diagram, I think we can go back to that slide. The overall healing includes the pharmaceuticals and supplements, which means if someone has a diabetes, then you must take your metformin, your insulin, your Genovia, and you also must take your supplements like vitamin B12, vitamin B6. At the same time, you have to also understand that someone with a chronic disease rely on the medication. They have to understand the importance of movement and exercise, the diet, the nutrition, the physical environment, which means where do you live? How do you live? How do you organize your life? How do you organize your day-to-day requirement? And how can you reduce stress by improving your physical environment? And lastly, but not the least, think about your relationships. If you are a patient with a type of chronic disease which needs it has a requirement that you should not have any stress, then look around what relationships you have. Are they supportive? Are they helping you? Or they are causing you more stress? So all those things put together as a mindfulness, where you are not just taking a particular medication for the particular disease, but you are also looking at what is going to make me feel good, how my physical activity is going to improve my disease condition, how my relationship with my family, with my friends, with my co-workers, how am I going to keep my house so that when I walk in the house, I'm instantly relaxed. So this is a model of integrated medicine, which is not just a pharmacopoeia or pharmaceutical based treatment. It has overall impact on the life. Can we look at the
Varsha, Varsha, 1 second. I think people are not able to see the slides. So let me get to the slides 1 second.
Mhm.
Are you able to see it? You should be able to see it. Okay. Okay. Are you able to see that now?
Can you see the slide?
Yeah, I think they are now. Maybe when we go to presentation mode, they cannot see. That's our problem. So I think they can now. We can continue.
Can they see
And
the
then share
presentation?
again. I'm checking. 1 second. Yeah, they can, I think now. Yeah. No, 1 second. Let me go present it back. Okay. Go ahead.
Right? So I was on the cam slide
You want to go to the next slide?
with the picture. There is only one picture.
I'm yeah. I'm on the mindfulness slide.
Yeah.
Okay. Continue, please.
Yeah, can you show me the slide?
Yes, I'm on the mindfulness slide. Slide number 3.
Yeah,
The
because
picture.
I can't see the slide. If you can.
You want me to go to the next slide?
Yeah, if I can see them, I see you right now. I don't see the slide.
Okay.
You can project the slide, please.
If I project it, I don't think they can see it. Okay, anyway.
Okay.
Can you see now? Can you see or no?
No. If they can see, it's fine.
Yes, they can see it.
They can see it.
Uh, If I present it, they won't be able to see, but I'll put it in this mode so that they can see.
Okay.
Your entire screen. Yeah.
You can see me, right?
Yes. Go ahead, please. I'm
Okay.
on slide number 3.
Okay. So I'm going to talk about what is the. I'm going to the next slide after the pictures slide. What is integrative medicine and what is mindful living? Now, most of the time, when a person becomes ill or sick, the modern medicine will always look at the diagnosis and say, okay, you have influenza, or you have tonsillitis, or you have a stomach flu. So, in the modern medicine, they look at the disease, what disease this person has. Now, contradictory to that, in integrative medicine, here they are going to look at who is the person. Now, for example, there is a person who's falling sick again and again and again. So they are not going to see what are the different diseases that this person is having, but they will say, okay, who is Varsha? Okay, who is Varsha? Who has, say, tonsillitis? So the integrative medicine looks at an individualistic picture where, say, for example, I am the person who has stomach flu, then they will look at, okay, where do you live? What is your environment? What is your physical environment? What are your other comorbidities? What is your inclination to have this disease? What are your supplements? Do you exercise? Do you eat balanced nutrition? Who is your support system? And how do you relax? So instead of looking at how many days you have this disease, how much was the temperature, did you take this medicine, how many times did you take this medicine, oh, if you finish the course, you will be fine. Integrative medicine just does not look at descriptive treat particular disease. It looks at an overall picture of what are the other things that this person will need this person. After that, the idea, the overall idea of which integrative medicine practices on base of the holistic approach, which means, as I explained you in the previous diagram, you look at the every perspective of your health spectrum and have a holistic approach about the person, not just the disease. So our urgent care, the urgent care scenario right now is there are 15 patients waiting in the waiting room. When they go inside, and the physician typically, or the nurse practitioner typically, they will have 15 minutes to ask the question. Okay, what happened? You are sick. Okay. Do you have cold? Do you have cough? Okay, how many days? And here's all the flu is going around. So here is your prescription for Tamiflu. You take it for 5 days and you're done. They do not ask, how are you feeling? They don't ask, oh, how do you sleep? How do you eat? Do you feel like working? How much tired do you feel? So all these perspective of an illness are addressed when you go to an integrative medicine practitioner. Also address what are the imbalances, what are the disharmonies that are in the person, which are the basic cause of the illness. Now let me explain you the imbalances and disharmonies. If I ask someone this question, so tell me one imbalance that you are experiencing right now in your life. You are going to take a pause and think about it, like, what is it that is not balanced in my life? And I know that every one of you have some answer. Ask me, what is the imbalance that you're experiencing in your life right now? I wish I had more time with my family because I'm spending too much time in traveling and I miss being with my family. I do not have interaction. So that is one imbalance that I'm experiencing right now. Then, if I'm talking about disharmony, now disharmony is something is an aberration from the harmony. What is an aberration from the harmony? So let me define harmony in such a manner that we will all get it. We wake up in the morning, then we have tea or coffee, we eat our breakfast, and that's how we start our day. Because that's how our circadian rhythm is designed to live our life in a harmony, particular thing at a particular time. We experience disharmony when for movie and we sleep at around 3 o'clock in the morning instead of sleeping at 10 o'clock at night. And when we wake up in the morning, we are groggy, our mind is not fresh. Or maybe we wake up in the middle of the day at 11 o'clock or 12 o'clock, and we do feel that disharmony, that something is not right because I kept awake till late and now I do not feel right. Another form of disharmony is those who do not have a set meal time, eat as and when the opportunities arise. The disharmony is also in the form of lack of physical activity. We must have a time allocated for physical activity. So those who cannot indulge in physical activity on regular basis, that can be an example of disharmony. So there are various examples of disharmonies. Long run can affect a person's physical health. And these are the root causes of illnesses which are addressed when you are talking to an integrative medicine practitioner. Form of imbalance and disharmony is again the circadian rhythm. Sleep. An essential part of our life is sleep. Does not sleep well, we accumulate what is known as sleep debt. Time. The sleep debt can result into an actual physical illness in the form of physically good, body feeling lethargic, joint pains, and there are so many other after effects of not sleeping well. One study they found that if you deprive a person of food, if you don't give food to a person, this person can live for 30 days without food. If you deprive a person of sleep, they cannot function after 1 week. 1 week is too much. So this is how much important our sleep is. So everyone who has some issue with getting a good sleep, to stay asleep, if there is an issue with that sleep issue, it needs to be addressed, because this is one imbalance and disharmony that can affect physical health in the long run. Patient-centered, it is patient-centered and not disease-centered. We are looking at an individual, not at a disease. We are not looking at which organ is affected. We are looking at who this person is, like overall picture of a person. So integrative medicine combines modern medicine with all the ancient approaches of healing. And I'm going to tell you in the next slide all these modalities which are considered as integrative medicine. Can we have the next slide, please?
Yes.
So here, about everyone who is listening to this webinar, please consider yourself as if you are in charge of your own health. Tomorrow, if you are not feeling well, you are equally responsible to make sure that you get better. So how does it start? How do you become an equal partner in your management of health? As soon as you recognize the sign that I'm not feeling well, the thing you need to do is do not delay, do not procrastinate. Because the moment you start telling yourself that this is something might, I'm going to schedule the appointment later, this is going to go away, time, all these things, you have to understand that you are postponing something which is so important to your own life. Take a pledge and you have to make a promise to yourself that my physical and my mental well-being, so I'm not going to delay even for a second when I'm not feeling well. And when you pick up that phone, when you make that appointment, and when you see your doctor, you have actually taken that responsibility as a partner. Where your power comes in play. Because even though you are a customer and you are seeking care, you are a partner. You are not just taking it passively. You are going to be active, you are going to be engaged, and that's how you are going to take control of your health. And that's how you are going to manage your disease effectively, illness or disease effectively. I tell this to all my patients that tell me who is going to care the most about your, and they get it. They say, it's me. So nobody is going to care about yourself more than you. So that's where it starts, the disease management. If you are not ill, you are not sick, still, you still are a partner. And what is known as a partner focusing on the preventive medicine. And now what is preventive medicine, which is actually the new focus in United States, that rather than falling sick and going to emergency room or to the doctor, we all are going to engage on the activities which will keep us healthy. We are going to prevent any disease, which means we are going to focus on what am I doing every day? Am I eating right? Is my diet appropriate? Am I eating a diet which is going to keep my body healthy? I'm going to look at the carbohydrate content, the fat content, the vitamins. Am I eating too much of food which is unhealthy, fast food? Am I incorporating all healthy ingredients in my diet? With knowledge, when you start asking questions, you are going to go out there and you are going to look for answers. When you look for answers, you might find a whole new world which will open up to you, and it comes like an aha moment, like, oh my god, I did not know that this food contains 5 grams of trans fat. Now a lot of people have questions about trans fat. What is trans fat? Now trans fat is nothing but it's just a layer of fat in our cellular membrane. Exchange of calcium and sodium, the cellular exchange, and we don't want trans fat in our body. So when you ask questions, you will find answers. Right. Why we should exercise? Now, if someone says that to lose weight, only the part of the game. We exercise not just to lose weight or to maintain a normal body mass index. We exercise so that we secrete endorphins, which keeps our heart and all our organs healthy. It's almost like a 1 hour of presentation where we can talk about what are different types of exercises, muscle strengthening, aerobics, non-aerobics, everything. Then we also talk about the use of vitamins and probiotics in our day-to-day life, and how we engage into management. And lastly, how we incorporate lifestyle changes which will keep us engaged in our own health management. So let's look at how many different modes of complementary and alternative medicines are out there, from which we can pick, choose which suits our individual the best. Okay, these are available complementary and alternative medicine practices, but it may not be for everyone. There are medicines which are available to us. There are many practitioners who practice Ayurveda. Ayurveda is most ancient natural medicine being practiced in India, and we all are familiar with that. It goes on the principle of Vata, Pitta, and Kapha doshas, and every individual has some or other or combination of doshas, and by treating the doshas, you eradicate the illness and you bring the status of health. Chinese medicine is almost similar to Ayurveda, which is profoundly being practiced in China and other Oriental countries. Native Americans who were native to United States of America and Aboriginal Africans. Then we also have Middle Eastern, Central and South American. Homeopathy is actually originated in Germany, which is now very popular in Europe, Australia. United States is the only country right now where homeopathy has not made its mark, but it's extensively being practiced throughout the world with very phenomenal outcomes. Naturopathy is again picking the natural ingredients from the nature and using them as medications in their natural form. So these are all the different kinds of alternative medicine. When someone says that what is best for me, I would say that you have to talk to your provider, because any of this can work for you depending on your individual condition. Ayurveda, Chinese, Native Americans, all these practices, what do they have common? Naturally available, animal-based, flower-based medications, and they are in their pure biochemical form. So in order to explore this area, go on internet. If you have question about how will alternative medicine will help my condition, then I would say internet has a lot of information, but at the same time, when you read this information, not becoming expert in that medication. So you have to look around and talk to your healthcare provider and ask that, do you know anyone who can guide me? Because I am told that nothing more can be done about my condition, but I want to explore. Is there anything natural that I can do? So you can talk to your provider, and that provider can guide you in the right direction. And I'm also going to give you some references at the end so that you can go and read more about each one medication medicine. There is another way of treating and balancing body through the body manipulations, where you are not taking anything by mouth, you are not taking any medication, but there are techniques, the body mechanic techniques, and they manipulate the body in order to relieve pain or align your spine or align your energy. Chiropractic practice is one of the most popular, which is well recognized in United States. And what they do is they align the spine. And the whole science of aligning the body is balancing the chi or balancing the energy is by balancing the spine. And they believe that they can heal pain, they can relieve the pressure on the nerve, pain. So the whole chiropractic practice is based on the placement of the joints and the bones and how our body is aligned. And osteopathic medication medicine is also in the same line. Massage is emerging as one of the most popular body manipulation practice in United States, and anyone who has taken a session of massage whether it is deep tissue massage or shiatsu or Ayurvedic massage or herbal massage. All these massages are focused on relieving the muscle tightness, which means pain in the body, in the muscle tissue, is when the lactic acid collects in the muscle, in between the muscle, and massage actually spreads out the lactic acid. It relieves the muscle tension, and it relieves the pain in some manner. Acupressure and acupuncture has emerged in China, where they have different meridians, and they apply pressure at certain pressure points, and or they put the needle, acupuncture needles, at certain points to channelize the electrical flow. And their science functions on the basis of meridians, that our body has certain pathways, and by applying pressure to these pathways or applying needle to these pathways, pain and the illness. And it has gained a little bit more popularity in this country because of its effectiveness in certain diseases. There is another type of complementary and alternative medicine which is known as energy healing, such as Qigong, Reiki, therapeutic touch, and bioelectromagnetic field treatment, which means that they believe in the theory that our body is a field of energy. There is a kind of imbalance in the energy flow, we fall sick. So they also believe that every healer has ability to provide a healing touch to someone whose energy level have gone low. And therapeutic touch, they work on the principle of simply providing healing energy to a sick person. And there is a science, there is a lot of studies being conducted. Evidence has suggested that the therapeutic touch has some degree of effectiveness. Reiki is helpful, and especially if you think about healing touch, that when we are not feeling good, if someone comes and holds our hand and says everything is going to be fine, it instantly makes us feel better. Now, this is a very, very crude example of a therapeutic touch, but the actual science of therapeutic touch is much more advanced way of providing the therapeutic touch, which can actually provide some degree of relief to someone. And bioelectromagnetic field treatment involves use of magnets, and they do this treatment theory that our body is composed of the electrical charges, and when you use magnets, it kind of forms a different kind of pathway and treats the organs. Other mind and body interventions in form of meditation, hypnotherapy, and cognitive behavioral therapy, dance and art therapy. And these mind and body interventions they have found very good results, especially in the behavioral disorders, depression, anxiety, children's autistic disorders. So all this complementary medicine a support or a booster system for those patients who need some degree of relief. And I'm sure some of you may have experienced the benefit of art therapy. I can vouch for myself that when I'm working on a very difficult project and I cannot think anymore, all I do is I take my coloring book, I sit down with colors, and by the time I have finished one page, my mind is clear and I have new energy. I'm ready to go ahead and finish my project in time. Dance therapy. Uh, there is literature out there, there is an evidence out there, but dance is a form of therapy, and I can talk about that for an hour at a separate time. Wonders. And it has been proven that, especially for patients with behavioral issues, dance can be of therapy, especially even for physical illness. In this country, gain a lot of popularity because you do one dance for 45 minutes and you feel like a new person. So, what is the first step? Now, when we talk about so many options out there, are we going to pick all the options? No. Are we going to do everything that is out there in alternative and calm therapy? No. To explore what is the fundamental disharmony in my life? What is my individual case? So we are going to write it down on a piece of paper. This is me. So me in the center. I'm going to make a diagram and I'm going to write Varsha in the center. Right? How much exercise does Varsha do? What kind of diet do I eat? What kind of stress relieving activities I do? What are my medications? What are my medications that I'm taking daily? What are my vitamins that I'm taking daily? Who are my support system? What makes me feel good? What is something that I do just to make myself feel happy? Right? Now, after putting that whole circle together, look at my lab results and see how well is my illness managed. And this is where your doctor, your specialist comes in play and will tell you, look, your this value, lab value, it is not under control. You need to do a little bit better. For diabetes, they will say your A1C is not in control. Someone with high blood pressure, they will say, look at your blood pressure number. It is not under control even if you are taking 2 medications. So look at the overall picture, right? What is your personal experience with the integrative medicine? Sometimes you may have consulted someone for Ayurveda, for Chinese medicine, for homeopathy, for naturopathy, and your experience may be it never helps. It doesn't do anything, right? So your past experience can also influence your current experience. Then you have to also look at this. Are you currently using any integrative approach? If you are not using that integrative approach, then you have to also address what's your mind block, why you have not looked at it. And you need to address those mind block first. Even before you pick up that phone and talk to someone, you have to find out, do you believe in it? Because if you do not believe in it, then there is no point in going in that direction. Now, have you clarified all your doubts? That's one thing everyone must do. It is also known as introspection, because you are not going to do anything that you don't feel right about. First, think about, is this something for me? If you think that this is not something that you really in future, then you should not go further. But I would still say, make that big nice circle where you can put all those pointers and see how your circle looks like. Now, if you have looked into a particular alternative medicine, then next thing you need to do is you need to talk to your doctor, healthcare provider, and ask the same question. I have this condition. I have done everything. Doesn't help me. Now I'm thinking about trying 1, 2, 3, 4. I want to try meditation. I want to try yoga. I want to try art therapy. I want to try naturopathy. I want to try Ayurveda. I want to try Chinese medicine. Pick one, talk to your provider, and ask about the choices. Now, why am I asking you to talk to your healthcare provider? Because they are being trained and they are being prepared about medicine approach. There are at least 5 years this progress. This is progressing in the direction where each and every mainstream physician will have a knowledge about which integrative medicine or which calm therapy is going to be suitable to a particular type of patient. You can also ask your physician or your provider that, do you have a referral? Because I'm sure they know some practitioners who are reputed practitioners, because you don't want to go to someone who is just experimenting. know the person who is actually using it. In your circle, you may want to know, hey, have you tried this and how do you feel about it? Is it the right integrative approach for your individual condition? So, for those patients who are suffering from chronic diseases such as high blood pressure, heart failure, diabetes, pneumonia, arthritis, and certain disease diagnoses such as hyperthyroidism, hypothyroidism, which are metabolic disorders, that you have to see a physician and do not compromise on your actual medical treatment, because remember, integrative medicine provides CAM, which is complementary, which is not replacing your current medicine, it is adding to it. Okay, and then spot the safe practice. Now, before participating into any integrative medicine treatment plan, you find out, number one, you must find out if the provider is certified. Now, in United States, there are certifying bodies such as Integrative Medicine Institute in Arizona by Dr. Andrew Weil. Now, if there is a practitioner, they must provide you a certification which says, I have graduated from an accredited program of integrative medicine, because no one can just claim that I'm an integrative medicine practitioner and I can provide you treatment because I know it. Nobody can say that. Someone has to go through a proper training and get certified to offer the treatment. Then are there any testimonies? Because once you go to someone, you definitely want to know, did someone else go there too? Did they benefit? And is the therapy proven safe by scientific evidence? You will not eat anything that is served in a restaurant if you did not order it, right? When you go to eat out, you say, okay, I want to eat dal makhani with naan. If they bring you a different dish, will you eat it? You will say, no, I'm not going to eat this because I did not order it. Similarly, you cannot put any medication in your mouth unless you know that if there is a scientific evidence that this works for this particular disease. So there is a way to find out, is it proven safe? There are ways to find out. They will say, okay, haldi is very good. This is now a new thing. Turmeric is very good. You should have turmeric every day. It is anti-inflammatory. Now, is this word of mouth or evidence-based practice? So there are ways to find out where there are testimonies, there are articles, and there are evidence-based research studies done that yes, this is safe, natural uh, element, that if we can take it by mouth, it's not going to harm. So it is about that if I take this integrative medicine treatment, number one, it should be safe, it should be proven safe, and least it should not be unsafe. So anyone who is going to reach for this approach must look at this component, that it is safe or unsafe, or it is uh, proven or not proven. Have something which is safe and not unsafe. So lastly, this is almost like my second last slide, and these are some of the articles. If you go on internet, and actually there is an organization, um, and these are very well reputed magazines which have articles after articles about integrative medicine. If you just use the keyword integrative medicine, you will be able to read a lot more about integrative medicine. What is it? How we can support our immune system, how we can live a life which is not just without disease, but it is more enhanced life, more safe, um, much more balanced. It is mind and body, so it's a holistic approach. And then we can actually enjoy the life the way we should be enjoying the life. This is my end today, and I'm sure that you will have a lot of questions. So if there is time, then I would say we can open it up and I will try my best to answer.
Thank you, Varsha. Can you hear me? Can you hear me, Varsha?
Yeah, I can hear you.
Okay. Thank you very much for that very valuable information about integrating medicine. We have a few questions. The first question comes: what is the difference between vitamin and probiotics? And I see that a lot of people are talking about probiotics. About several years back, I never heard that word probiotics. And all over
Okay.
that we have vitamin shops, right? People are taking vitamins, but I hear something like probiotics.
Okay. So probiotic is not a vitamin. Vitamins are vitamins, okay? It's vitamin categories A, B, C, D, E, okay? Now, probiotics are nothing, but it is the naturally existing bacterial flora in our intestine. So, it's acidophilus is the bacteria which lives in our body, in intestine. And what they do is they help digest the food. Now, due to certain conditions, intestinal line is affected, and if there are less number of bacteria in the intestine, then they said, which means this is the flora of the bacteria that we take, and it kind of helps us with the digestion. So simple way I can put probiotics is like yogurt. Remember, if we had a stomach upset, our mother gave us rice and yogurt and everything was fine. So that probiotic therapy goes way back to our ancient Ayurveda. Eat yogurt and rice and your stomach will be fine. The same therapy, it is probiotic now in a advanced and kind of, I would say, pharmaceutical form is probiotic. So it's not a vitamin, but it's very, very helpful for our body. Probiotic to anyone and everyone.
Okay. Thank you for that question. Do you have any other question in the chat? Uh, I think you talked about one of the things that you talked about massage, and there was a question over the phone. What type of massages are there? And it is good.
What type of massages are out there?
And which one is
Okay,
good?
which one is good? Uh, I am a big fan of massage, so I would say every type of massage is good. When you go to any massage therapist, they usually ask you what type of body problem do you have, what area of the body that you want more attention to. I recommend anyone who's going for massage, go for shiatsu, ask for deep tissue, because deep tissue involves a lot of pressure. Unless you are used to it, you start with a light, uh, and you should be fine. And Ayurvedic massage is different. They focus on a different body part, but always go for a regular one. Shiatsu is fine. Deep tissue comes as the second stage. If you can tolerate a light massage, go for the deep tissue later.
Okay. Any? Yeah. We have 5 minutes left. If you have any questions, please send it to the chat. One of the, as I was listening to the talk, one of the eye opener for me was you said homeopathy was invented in Germany. When you talked about homeopathy and naturopathy, I got the whole word called pati, and I thought it's from India.
actually, um, actually, the word PATI, if you go into Latin literature, okay, homeopathy is based on the principle of like cures like, which means if you eat onion and if your eyes are watering because of ammonia, has a disease disease which causes the watering of eyes, then the homeopathic medicine, which is known as Allium cepa, onion, and that medication, if it is taken, it will clean of the eyes. So that science is complex principle, complicated science. It's very difficult to explain common people. Cures like, or the similia similibus curanter principle of homeopathy, very extensively practiced in India. And one of my friend has a research institute in Bombay, specially treating the autistic children. Cases after cases documented that it works beautifully. More research is being conducted. Form of alternative and integrative medicine that is being recently started in India. Varsha Singh, who is also another close friend of mine, he has started a program called Appetite for Change. This program, he has actually claimed that he has reversed the diabetes. That means he has taken patients off the medication and they have controlled diabetes only by eating certain type of food, which is organic food. So there are so many avenues that we need to explore. Sky is the limit actually. If you go out and see, and then I have recommended if you watch Times, it talks about the reversal of the atherosclerosis. And an 85-year-old lady who had heart disease, and she was told that now you should prepare for the end of your days, and she lived 5 years. Her diet. So our human body is a miracle actually, and we do not know so many mysteries, and we can explore how we can manage our physical and mental health just by into this healthy living, mindful living. Focus on what is important for us. Why are we living? Do we have to make our life stressful? So these are all the questions when we do this introspection. Look at your surrounding. Look at the plate on your food. Look what you are putting in your mouth. Look what are the ingredients in the food that you are eating. Is it natural? How much chemical component is in that food? So if you look at the overall picture, it's a lot of times I had this aha moment for myself, and God, I was eating that. So if I look back 5 years down the road, I'm not even touching those food which I'm eating right now is all fresh, it's all organic. I feel that my body is different and I'm feeling different up here. So this is just my way of sharing. I'm not advising. I'm not telling that you should do this. I'm not forcing you. But what I'm doing right now is I'm sharing my experience to get out of our box and look at something different which is out there, explore a little and see what is appealing for you, what makes you feel good, and take that, take what makes you feel good, right? That's the message from my presentation right now.
Yeah. We are actually a minute left, right? And actually, we are time out 9:30 it is. I just
Okay.
want to thank you for this eye opener, right? One of the important things I think a take home message for me is you gave a variety of options that we have, alternative medicines. You talked about alternative medicine. You talked about body. Uh, you talked about energy healing, other medicines and things like that, right? Body medicine, I think. And I think what you said at the end is put yourself in the center and have a circle around it and see what is best for you. I think that's one of the take-home message. At least I got out of it. And I think many of our viewers watch this. Based on the past history, I've seen many people having this session viewed many times, and depending on when it is appropriate for them. Thank you very much for spending an hour with us and sharing your experience. It is much more useful for all our audience, and we wish you all the best. Thank you very much. And last but not least, can you just share your email ID and phone number if anybody has any questions on this phone.
Absolutely. See, the best way to contact me is by email. It's varsha.singhapn@gmail.com. I'm going to spell it out. varsha.singhapn@gmail.com. And that's the best way. And anyone who needs my phone number, I will definitely give if you email me. Thank you so much.
Okay. Thank you. Bye bye.
Thank you. Good night, everyone.
Right.